Let's talk about when you are good to be around people, go back to school, go back to daycare, go back to work, whatever it is after illness. My name is Dr. Lauren Hughes. I am a board certified pediatrician. Let's talk about it. Say you've had a generic cough, upper respiratory illness, COVID, flu, other common cold things. The general rule is you need to be fever-free for at least 24 hours without the use of medication. Fever is 100.4 Fahrenheit or 38 degrees Celsius. If you have not had a temperature that is that or higher for at least 24 hours, you have not taken any antipyretics, meaning like acetaminophen or ibuprofen, then you are good to go back. If you've had a GI illness, you've been vomiting and diarrheaing, you have been full attic and basement cleansing, the general rule is 48 to 72 hours after. There are some things that are a little bit more infectious, like norovirus, that can still spread potentially for longer. Majority of transmission for most diseases is early in the disease course, whenever your viral load or the amount that you have in you that is making you sick is highest. If you are going to be around someone who is immunocompromised, if you are going to be around a newborn, if someone on medication that suppresses their immune system, something like that, then I usually like that to be a little bit more like 48 to 72 hours. Also, just be honest with the people that you're going to see and say, we've been sick, we've been fever-free for 24 hours. Get their comfort, because that's going to depend on the person. So the other thing is that you can have cough and runny nose for weeks after an illness and not be considered really contagious, because it is going to be just a remnant part of that illness, this post-viral cough or whatever. That is not necessarily going to be like you can't come, you can't go to daycare. Again, it's just going to depend on the comfort of the people you're visiting and the policy at your school and daycare.